What happens when you start losing your hair in your late 20s? You see gradually your hairline is going back, your top and front as well as the crown, slight thinning has started, your scalp show is there, you are turning 30, 35, then 40, you are seeing your children grow up, getting graduated, getting settled, and then at around 50 years of age, finally you decide that now it's time I get some makeover of my scalp, I get some better hair to comb and a better look. Finally, now I have time. This is the story of our today's patient. Let us see what changed him, how he got his looks changed, his face framed, and what all steps we did for him. One wrong treatment can change your hair forever. But if you have your first hair transplant right, maybe it's one of the best decisions you make in your lifetime. Why? Because then your donor hair, which are taken to hide the bald spots to give you a proper frame, get the best of usage. Otherwise, your donor hair is depleted and you do not get any growth here. Hi, my name is Dr. Preeti Saraswat. I'm an American board certified hair transplant surgeon working at Saraswat Hospital, Agra. If you're having a slight thinning of hair also, maybe this channel is for you. You will be getting a lot of science-backed solutions, testimonial videos, and you will be seeing a lot of before-after pictures and many more educational videos. So do not forget to hit the subscribe button. So as I mentioned earlier, today's guy is of around 50 years of age. He's exactly 52 and he wanted a better hairline and filling up of the temple area, front, top, up to the scalp. So he was actually wanting a proper framing of face and he wanted to see doctor how I would look before I actually undergo the hair transplant. So he took help of Saraswat Hospital App and he clicked on the PeekAI feature and then he uploaded the front and top picture, and within 24 to 48 hours he got back the probable results, how he would look after a transplant. Also, we gave him a probable number of grafts which would be required by him. Do not forget to click the like button if you're learning something valuable. So as you can see in his picture, he was Norwood scale grade 4 to 5, I would say. Exactly bookish picture was not there. He was still having some hair in between because of the off and on medical treatment he had been taking, thankfully. But he now wanted a proper hair transplant so that he can get better hair to comb. He was concerned a lot about the pain and his safety. So we here at Saraswat Hospital think that safety is the #1 concern. So we have the anesthesia drugs, we have the emergency tray, the oxygen, a defibrillator, all the state-of-the-art operation theatre along with a very well-trained team. So you can feel that you are in safe hands. We do your blood test first. In case you are above 35 years of age, we would get a physician certificate first that you are fit for surgery. Maybe we do your ECG, your blood investigations so that we know that you are perfectly fine before you are undergoing surgery. After the physician says yes, only then we take you for surgery. People are much concerned about pain. I must say that when we are giving a local anesthesia, we use vibration device and we use very fine needles so that the pain perceived is minimal. That is the only time if you feel some pain you can, but otherwise when there is a ring block, the whole procedure becomes painless. If you want to tell your grade of hair transplant or you have any question regarding hair transplant, you can write in the comment section below. You can see on your screen the trichoscopy report of our patient, and we used the follicular unit excision method and we used around 3815 grafts for him from the donor area by FUE method to the recipient area by pre-made slit method. If you want your personalized treatment plan, you can click the link in the description below or call us for consultation. You can now see on your screen his before after pictures. So his day of surgery pictures, then 3 months after surgery, 5 months after surgery, 6 months after surgery, 7 months after surgery, and then 9 months after surgery. So the 9 months result is not the final result. He will be getting more hair, more density of hair in the months to come. So the final result would be around 12 months. Share this video with somebody who needs a hair transplant and above all who needs hope that he will get his hair back. If you want to understand how hair transplant is done, you can click the video on the right to know the step-by-step hair transplant procedure.